VR motion sickness is miserable. I've experienced it many times. That horrible wave of nausea that comes on you when you've been playing in VR for too long or doing the wrong things in VR. This video is going to share loads of awesome tips to help you prevent VR motion sickness. And I believe that most people can get to a point where they rarely, if ever, experience motion sickness in VR and can enjoy all of the experiences that VR has to offer. So what causes VR motion sickness in the first place? Well, it's actually really simple. It's just a mismatch between what your eyes are seeing and what the vestibular apparatus, or the balance center in your inner ear, is experiencing. So when you're moving around in VR, your eyes tell your brain that you're moving forward, that you're turning, that you're changing posture. But the vestibular apparatus in your inner ear is telling your brain quite a different story. It's saying that you're standing still or hardly moving. You're not walking forward, you're not turning. And it's this mismatch between the signals that confuses your brain and starts to produce the symptoms of VR motion sickness. How do we stop this from happening? Well, you can either build up your tolerance to having a mismatch in the signals. Alternatively, you can try to ensure that the signals that your eyes are sending back and your inner ear is sending back to your brain are more closely aligned, and therefore you'll be less likely to experience motion sickness. Let's get on to sharing my top tips to prevent VR motion sickness so that you can enjoy all the VR games that you want to play. One of the best tips I can give you is to play in short sessions and make sure that you stop playing before you get any symptoms. If you can manage 5 minutes without getting any symptoms, then what you should do is just build this up slowly but surely over a number of weeks and months. If you do this, your brain will slowly adapt and you will get used to the sensation of using a VR headset, and you should be able to extend the amount of time you can use your VR headset before you get symptoms of motion sickness. The other reason why you should take regular breaks is that if you consistently get nausea and dizziness and symptoms of motion sickness when you use your VR headset, you will come to associate using your VR headset with getting nauseous. And it can actually become a self-fulfilling prophecy. So you put your VR headset on, and because you've had nausea every other time you've used your VR headset, you're almost destined to get nausea and symptoms of motion sickness every time. So stop before you get any symptoms, build it up slowly, and have a bit of patience. You will get there. Another great tip is to only play games that have a reputation as being comfortable experiences and less likely to cause VR motion sickness. So typically this will be games where you're standing still in VR and there's not very much moving around, bending over, turning around manually, where what you see in the VR headset does not match what your brain is experiencing through your vestibular apparatus. On the Quest Store, games are rated into comfortable, moderate, and intense experiences, so you can actually just pick games that are more comfortable. And once you're able to tolerate comfortable VR games for a long time, you can slowly move up to moderate or intense games and see how you get on. Stationary games are much better at preventing motion sickness rather than games where you're moving or running around in VR. I find Beat Saber and Job Simulator to be very comfortable games, whereas games like Green Hell and first-person shooter games in VR require a much stronger stomach, and I really only recommend these for people who either don't get VR motion sickness or have built up a tolerance to it so that they can play these types of experiences for a long time. There are a number of in-game settings in most games that can really help with preventing motion sickness. Number 1, teleportation movement. You're much more likely to get VR motion sickness if you're using a thumbstick to run around in VR, or if there is involuntary movement that you're seeing in the VR headset that is not matched by what your body is experiencing in real life. A great way around this is to use teleportation movement. You can use your thumbstick to teleport from place to place in VR, and this minimizes any actual movement in VR, so you're just hopping from one stationary spot to another. Another in-game setting that most games have is a vignette setting. With vignette on, your field of view will be limited when you move or turn. This means that the periphery of your vision will turn black and you'll kind of see tunnel vision. And this actually can have a big impact in reducing VR motion sickness, and is something that you should definitely put on if you're prone to motion sickness in VR. Once you get used to VR and you're not experiencing motion sickness anymore, you can dial this back or remove it completely to increase the immersion level. If you're playing games where there's the option to physically turn in your play space or use a thumbstick to virtually turn your character in the game, I would always suggest physically turning in your play space. The reason why this is a good idea is that your body physically turns, and this matches what your eyes are seeing in the game. So we avoid this mismatch of experience between your vestibular apparatus and what your eyes are seeing, and hopefully this will help to prevent motion sickness. When you get your VR headset, you should make sure that the IPD is set correctly for your eyes. So this means the interpupillary distance, the distance between your two eyes. If this is offset, you may see a less clear picture, or you may experience double vision, and this can significantly increase your risk of feeling nauseous or getting motion sickness in VR. Some headsets, such as the Quest 2, only have 3 fixed IPD settings, but most other headsets allow you to either manually or automatically adjust the IPD so that it's absolutely perfect. Moving on from this, if you wear glasses in real life, you should consider wearing your glasses in VR, particularly if not wearing glasses makes the visuals a little bit fuzzy when you're using your VR headset. Smooth performance is another really important thing in preventing VR motion sickness. You need to make sure that your VR experience is as smooth as possible. So this means having a high refresh rate headset, but also ensuring that your hardware can keep up with that refresh rate. This is probably more relevant for PC VR users. In my circumstances, when I'm using very graphically demanding games on a PC VR headset like Microsoft Flight Simulator or DCS World, I really struggle to hit the native refresh rate of my VR headset, and sometimes things can be a little bit juddery as you move. If you're somebody that does struggle with VR motion sickness, you should prioritize smooth performance at all costs. Turn down the graphics settings and make sure everything runs buttery smooth, and you're much less likely to experience VR motion sickness. It's really important to stay cool when you're playing VR, as feeling too warm can really increase your risk of getting VR motion sickness. So turn the thermostat down in your room, take off a layer or two, and consider even setting up a fan in your room to keep you cool while you're playing. It will make a big difference. I came across one really interesting way of preventing VR motion sickness that I couldn't wait to share in this video, and that is to get somebody else to tell you that you'll be okay. There was a study done of sea cadets where they told them before they went to sea, you will not experience seasickness. And as a result of this verbal placebo, sure enough, they did experience less seasickness. So if you get somebody you trust to keep telling you you will not experience VR motion sickness before you use your headset every time, there's a fair chance that it'll help reduce the likelihood that you do experience nausea and other symptoms of VR motion sickness when you use your headset. Another tried and tested way to reduce motion sickness is to take ginger before you use your VR headset. This has been used to prevent travel sickness and seasickness for a long time, and there have actually been loads of studies that have looked at the effect of ginger on reducing motion sickness and other types of nausea. And do you know what? The evidence is pretty good. Now, your individual experience may vary, but I've certainly heard of loads of people who like to eat a bit of ginger, drink a bit of ginger ale, or have a ginger biscuit before they play VR, or before they do another activity that could cause motion sickness, and it really does work for some people. So I'd highly recommend you try this, and hopefully it works for you. If you've got any other tips to prevent VR motion sickness, please tell me about them in the comments section below. There are so many people out there who experience VR motion sickness, and we all want to do anything we can to prevent it. So please get typing. I'd love to hear from you. If you've enjoyed this video, please check out the rest of the content on my channel. I've got a slowly growing number of videos available to watch about all aspects of VR. Check them out and hopefully you'll find something that you enjoy. Thank you so much for watching this video, guys. I really appreciate it as always, and I'm looking forward to seeing you in the next video.